one of the things I still really enjoy about the job is the workup and diagnostic process. Even though a lot of times we do reach a diagnosis, keep it in perspective because the complexity of disease sometimes means that we don't get the diagnosis. Sometimes it means that we don't figure out what's going on. Sometimes the patient gets better despite what we did. Sometimes the patient gets better and we can't figure out why. I don't ever want to make it seem like we always get it right because sometimes we don't get it. Or sometimes some parts of the workup can be safely done as an outpatient. I'm saying this so you don't think that we always have to get to the bottom of everything. Sometimes your job is just to ensure that the patient is stable and that they can continue their workup as an outpatient. There are some things like biopsy results that can sometimes take a week or two to come back. You're not going to keep them hospitalized that entire time, especially if they're stable. And so sometimes you don't get it when they're in-house. You have to coordinate with all the outpatient specialists and talk to the PCP. Call the PCP and say, hey, this is what's happened. Here's where we are in the workup, and we're counting on you to pick it up after we discharge the patient. That's okay. Don't feel like you failed if you didn't get it, as long as you got the patient moving in the right direction. And kind of along those lines, it's important to remember that sometimes we don't necessarily drive the workup. Sometimes we're just custodians between all the specialists. It's still an important role because oftentimes we're the person that decodes what all the specialists have been kind of throwing at the patient and their family. Sometimes we're the interpreter among a lot of different specialists. There's no shame in being the custodian and keeping track of all the different specialist workups, even though you yourself may not be contributing that much. It's still a very important role. Sometimes it can be appropriate to have the specialist drive the care. Now, of course, they should all be updating you, and you should be updating the patient and the family. And sometimes it's appropriate to actually just be the custodian and let all the specialists drive, and then make sure that everyone's on the same page. Our role as hospitalists can vary greatly. Sometimes we can drive the entire hospitalization and workup, and sometimes we're just kind of standing back and a bunch of specialists are doing it, updating us, and we're updating the patient and the family. So the roles can be very medical, and sometimes they can be very kind of detail-oriented and synthesizing information with other specialties driving the workup. So the role of the hospitalist can be very varied that way. Even if you're not driving the workup, you're still the one that's kind of advocating for the patient. There are some times where you want to follow the specialist recommendation to a T, but sometimes the specialist recommendation is not 100% appropriate for your patient, or it's not appropriate in the context of other things going on. So sometimes you need to kind of take with a grain of salt what the specialists recommend. Ultimately, it's still your patient. So sometimes you do what the specialists say, sometimes you take bits and pieces of what the specialists say.